Thank you to our audience who joined us here today. We're excited to be here with Andrea Creasy from Ascension, and Andrea works as a physical therapist. So we are certainly excited to hear about her journey to where she's at today and learn from her expertise. So, Andrea, if you wouldn't mind starting off just with a general summary of your career journey and the progression of your career that got you to where you are today.
All right, I'm Andrea. She said, I've been a PT here at Ascension for 12 years, was my first job. So I went to Neenah, Fox Valley here for high school. I really wasn't sure what I wanted to do and didn't have all these nice career opportunities like you guys do to get to learn about healthcare and what it is we do exactly. So I kind of was interested in PT at a young age. I was 12 and in sixth grade, and my friend's mom had gotten in a car accident and severed both her carotid arteries and had 7 strokes in her brain. I went over to her house a lot because they had cable and my parents didn't. So I spent a lot of time over there, and essentially they didn't think she was going to make it. They took her off the ventilator and she did, but she couldn't talk, she couldn't walk, she couldn't feed herself, she couldn't write, really couldn't do much of anything. And so she had home care therapists, both physical therapy and occupational therapy, coming into the house. And so it was so cool to have that opportunity to watch her regain those abilities and regain independence and be able to write again, be able to talk again, be able to feed herself. A lot of the things we take for granted. And that's really what kind of caught my eye to physical therapy at first. And this will make me sound really old now, but when we had career guidance and things, I remember literally looking at a book that told us how much money about average salary was for each career. And that's about what I got. So really it was through college, and I had to make a quick decision because I knew I kind of liked physical therapy. I had it as a teenager. At the time, Marquette in Milwaukee had an early admission program for PT. So you would start, on your master's as you were working on your undergraduate degree. And so it was 5 years, you would do all of it. There's about 600 applicants for that program, and they accept about 40. And I did get accepted, except that felt like a lot of pressure in a senior in high school to make that big decision in my life and be tied in. So I really did have interest in going into medicine and psychology. So I went to UW-Madison and was a psychology major. And with that, still did the prerequisites for PT school. What really shifted me was I think I was interested in psychology and trauma psychology and trauma counseling and things like Criminal Minds, all that kind of thing. I think we watch those shows, we find that very interesting. Well, my abnormal psychology professor had to testify in court in a very difficult case. You guys would be too young to remember that, but it was in the Andrea Yates case, and she drowned her own 4 children. And he said it was really a challenging time in his career, and to blur the lines of mental illness and what's criminal and stuff, it was difficult. And I never really thought about that aspect of being a psychologist in that world. And so that's honestly was my turning point to be like, okay, I think I'm going to do PT. So I graduated Madison in 2005. I did end up with a kinesiology major also, just because those were the prerequisites basically for PT. So really the most common majors you're going to see are psychology, which I'm very thankful for that background, because when people are in pain, there's a lot of psychology involved. Kinesiology, the study of movement, is also another really common major, in exercise science also for PT. At the time I graduated Madison in 2005, most of the schools for PT were at a master's level. You get a master's degree. Now, Concordia in Mequon was the first accredited doctorate program in physical therapy. So they had their program up and running. La Crosse was just starting, and so they weren't really accredited yet. So it was a tough decision. So it would have been 2.5 years of school for a master's degree at Madison versus 3 years at Concordia for the doctorate. So it cost a little more, but honestly, I knew I probably would be challenged to go back to school. I knew that's where the career was going. So I did go to Concordia, did get my doctorate, and graduated in 2008. Started here after that. Now all the Wisconsin schools are at doctorate level. So I don't have any regrets for doing it, and I'm very happy I did. And so part of grad school, It sounds like a long time in school. So I do encourage kids to get those college credits in high school if you can. It makes undergrad much easier. But a lot of that time in grad school is time on clinicals. And so just like physicians do residencies in different areas, we also have to do that. And so you're gonna have, and that's really what appealed to me about PT. I didn't feel as tied in because you have pediatrics, which is actually where my strong interest was. Have cardiopulmonary working with heart and lung conditions. You have outpatient orthopedics. You have sports medicine. You can work inpatient in the ICU. You can do inpatient in the NICU. Most people don't think about PTs being. So, it was kind of felt good because I'm like, I'm not tied in. If I don't like this, I can do this. And then you also have like your inpatient neuro. So our clinicals have to be in all of those settings. And so I had to have an inpatient neuro clinical. And that I actually did at Theta Clark and Nina. And so each school structures their clinicals differently. So mine, I had 3 9-week ones for my bigger clinicals. When you get towards the end of those, you are expected to be independent, managing your own schedule and everything and ready to enter the work world. A lot of different things they look at and that you're working on, but you can pick them. I went to Florida for my last 2 clinicals, January through May before I graduated. There's a lot. And so I did a pediatric at All Children's Hospital, a 9-week, and then that was tougher than I thought because there were a lot of non-accidental traumas or abuse cases, and then a lot of childhood cancer, amputations from bone cancer. And I took a lot of it home. I thought I was tough enough for that, but that was kind of when I changed my mind from peds. And so I made it all the way through my last year in grad school thinking I had tied in what I wanted to do, and ultimately ended up a neurotherapist for about 3 to 4 years, and then started up with the orthopedic surgeons.
I just wanted to point out that, I think you brought up an important point that our life experiences can definitely shape our career directions as well and choices as well. And the fact that, you had physical therapy on the back of your mind and didn't totally discount it, and you ended up coming back to it later on. So I think an important message to all of our students that, don't totally write something off because you're not really sure what your life experiences will bring down the line, to bring you back to some of those interests that you first considered. So we do have a question from our audience. Are there any classes in high school or college that you would recommend or that are important to take?
Oh, so actually, human anatomy was not offered when I was in high school. So I know some of the high schools offer that now. I know not all of them, but I would highly encourage getting started on learning human anatomy before college, even. I had anatomy in undergrad, and it wasn't anything like what it was in grad school. So it was pretty intense. For PT, we need to know all the muscles, where they attach, what nerve innervates them, what their action is. And that's a lot to learn. And we need to know everything else about the body too. So having the doctorate level, what really that means is by state law, PTs have direct access, meaning you do not need a physician order to go see a PT. Some insurances like require it, but we need to be able to identify, is there something else going on with this patient that maybe they do need to see a physician? So you need to know more than just the musculoskeletal system. So in college, there is a list of prerequisites. So I normally do have that in my PowerPoint. Psychology is on that list. So whether you're a psychology major or not, you have to take a psychology course. I can't encourage that more, especially as you get more into patients that have chronic pain. But even in somebody that just has an acute injury, they might be out of work. They might not be able to play that sport. It might be their senior year, and they were really planning on playing basketball in college, and this was, it can be a big deal. And so I do have a lot of people that are crying and upset, and in general, when we talk about humor and I go out to the waiting room and I ask, how are you doing? I joke about, I don't even know why I asked that, because if you were doing great, you wouldn't be here. And then they do make you take physics and biomechanics, which is, I hated physics, but in a biomechanics perspective, that's physics applied to the human body, and that a helpful course too. So
Sure. So those anatomy and psychology and physics, so science and kind of human connection type courses.
Yep.
So, Andrea, I believe that you had planned to give us a little tour of your physical therapy area and talk a little bit about some of the equipment that you use with your patients.
Yes. So I will just add that I do primarily outpatient orthopedics now. I do work a couple inpatient weekends. I have a unique little clinic here. So it's just me in here. So I'm able to show you more things actually. I work here 3 days a week. And then 2 days a week, I was at our large facility over on Milky Way where we have about 40, 50 PTs. We have a pool, a huge gym. Literally yesterday, I switched locations and started at a new location inside OSMS, which is our orthopedic surgeons went independent. And so we have a brand new little clinic in there. So I'm in that transition right now. But I work very closely with the physicians and I'm only PT up here. So I don't have a ton of equipment, but I have our small supplies. So I did try to separate some of this into what I would use for evaluation. So when a patient first comes and sees me, the order might say shoulder pain. It's my job to try to figure out, is that coming from their neck? Is it tendonitis? Is it overuse? And so we have evaluation tools that we'll use. So that first day I meet someone, I'm trying to figure out what's going on. Why are they hurting? And so some of those tools are over here. I'll try and get this here. So what you'll see, those are dynamometers, these three here. Those I use to measure range of motion. So they're different sizes because I might be measuring a hip, a back, a finger, ankle. And so as much as I didn't think I'd ever use geometry again, this measures joint angles. So I use it every day. Reflexes, a reflex hammer here. This is actually a tuning fork. If I have somebody that I might suspect it's a bad ankle sprain and there might be an ankle, I might think it might be a fracture. This will hurt a lot because the vibration of the tuning fork will go into that crack or where the fracture is. And then you're going to see that these are pinch grip. So this is going to test the grip force. So we'll also test muscle strength. So I'm going to look at flexibility, range of motion of that joint, and usually the joint above and below. This is a grip strength tester. So this would also tell me how much someone's grip strength is. So when I do the in-person career days, the kids have a lot of fun seeing what their grip strength is. And then here, the reflex hammer, just literally a measuring tape because I might measure swelling if swelling's present. So those are evaluation tools. But then also the big part of PT is we have to treat. So someone's weak, what do we do? So the Therabands are all different colors, so they're different resistances. So this is a nice tool I can give for somebody to strengthen at home. So there's actually 5 different colors for treatment. This is literally just a range of motion bar. I'll tell people to use a broomstick because they can work on range of motion using their good arm, or if it'd be a shoulder patient. These are just some pulleys that we would also use for shoulder range of motion, and they can take them home and put them in their door. And weights, obviously. So that gets more our therapeutic exercise realm. And then same with like the Bosu ball, I might work on balance. It's actually something I can use for a lot of different things. I could use it for someone even in a wheelchair that might need to work on sitting balance, and then I can put it on the mat, they can transfer on it. I can use it for the 80-some-year-old that had a fall and the doctor wants them to work on balance. I might just have them stand on it. That's going to be tough enough. I might use it for that ACL repair that really needs to work on stability. I might have them stand on one leg on it. Then for shoulder patients, sometimes I'll actually flip this over and then have people do squats or do planks or just balancing with one arm. So that's a good example of one piece of equipment, because you can see I basically have a bike in here that I can use for a lot of different things. And then otherwise we might use some adjuncts. So some of us are more manual based therapists. So I also have, this is like a Graston tool we might use to help with mobilizing soft tissue. Kinesio taping, probably some of you have seen. I might use that to inhibit or stimulate a muscle. Theracanes are also another home tool for working on tight muscles. This little scar tissue tool we use. And actually this legit is a sink plunger. And I might use this like just kind of at the dent doctor. I'm trying to pull out fascia or tight muscles. And so that actually is similar to cupping. And then in front of that, you're going to see actually some electric stim devices we might use for pain or strengthening a muscle. These are my needling supplies. So I also do dry needling. So that's another example of how the profession progresses and changes. Had you asked me 10 years ago if I'd be poking needles in people, I would say we don't do that in PT. And then also have cervical traction, which is just a traction device for neck. So people with neck pain or headaches. And then some more balance stuff. So these are all different types of balance boards that I can use. And this one is a BAPS board, or I might use for ankle. So it stands for biomechanical ankle proprioception. That would be like after an ankle sprain. So those are examples of all the treatment things that I would have.
All right. Definitely lots of tools of the trade to be utilizing in your therapy programming with patients. One question that we had come in the chat, Andrea, was can you talk a little bit about the difference between what a physical therapist does and what a PT assistant does, and how are your roles different?
Yep. So first of all, the schooling is very different. So PT, like I said, doctorate level now. PTA is still an associate degree, so it's still a 2-year program. So I will say that often in my career days. I mean, I love my job. Every day is different. I get to meet and help a lot of people, but I know it's a lot of school. So I do encourage the PT assistant programs because that's 2 years. You get to do a lot of the same things we do as PTs. So the main difference is PTs have to do the initial evaluation or that first day we see a patient. And then PT assistants can do all the treatments or the treatment sessions. By law, the PT assistant can see a patient for 10 visits before the PT has to. And one PT can supervise 4 PTAs. And honestly, we don't have to sign off on their notes. Like basically, we're just dictating the plan of care. So if say that patient might fall or have a hospitalization, we again, as the PT, have to see the patient before the PTA can. And then for Medicare patients, we have to do the discharge or that last visit. The only other thing I would say that's different is PTAs can't do spine manipulation. So that would be a more aggressive mobilization for the spine. That's not in their practice act for the state. But otherwise, they can do everything that we do.
Fantastic. Thank you. So what would you say are some of the challenges or the most difficult parts of being a physical therapist?
Insurance companies, and you're going to hear that from anybody that works in healthcare, and especially from a physical therapy perspective, when we have trouble getting visits authorized, when a patient is trying to do good for themselves, that's very challenging. We do get some patients that don't want to be here, and maybe it might be that they got kind of dragged into the opiate world and their doctor said they had to come to PT to get more pain meds. Sometimes they have to do PT to get an MRI or to get injections. And there's a reason for that they have people try PT, and some people give up before they start, and that's challenging. But yeah, like I said, a sense of humor really goes far away in my job and in building rapport with patients. And like Nikki said, you really do have to get a vibe for your patient, what's acceptable for them, and how much kind of humor you can incorporate. But yeah, I would say those are probably the most difficult pieces. And then
Right.
paperwork too. I mean, it's nobody's favorite thing.
Absolutely, but it's one of those required components to many jobs, right?
Yep.
Can you tell us a little bit about the hours that you work currently? How many patients do you see in a day? And then any guidelines? There was a question about hours related to your internship experiences.
My schedule is very flexible in most PTs. You will hear that. I mean, a lot of times we're able to sort of make our own schedules for what we want. So we do have a lot of PTs that are working 40 hours and are full time, and then they decide after they have a child or something that maybe they want to cut down to 20 hours, and maybe that's 2 10-hour days. And so that's one of the biggest benefits I see to actually the PT profession is the flexibility we have with that. Now, depending on the clinic, so some clinics are very, very productivity based. They might have you do patients every 40 minutes or every half an hour. So on my clinical in ortho, we only were allowed a half hour with patients. Ascension has a lot of flexibility that some of my more difficult patients I can schedule for an hour. I can, see them for longer. I work 40-hour weeks. I used to, when I started, I worked 4 10-hour days. And at that time, I would probably see 13 to 16 patients a day. It was a lot. I was used to that from being out on my clinicals, but as I've progressed and my caseload has gotten more difficult over the years, the doctors know me. I generally get the people that have had PT 3 or 4 times and not done well. So my job to figure out why and what can I do different. But yeah, so now I actually, when I came out to work with the surgeons, they don't work 10-hour days, they work 8 to 5. And so I had to adjust that. So I actually Monday and Wednesday, I work 9 to 5, and then Tuesday and Thursday, 7 to 3:30. Generally doing paperwork, probably an hour and a half after those times, after patient care. Fridays, I work 8 to 4. That was all kind of my schedule and what we were adjusting to be around the doctors. In general, I would say PTs, they do like to try to have you either in early or a little later just to capture people that want to come in before and after work.
Some questions have been surfacing connected to, you mentioned the variety of different areas that physical therapy can kind of specialize in. So what advice can you give students who kind of don't really know, maybe they're interested in physical therapy, but how will they decide or figure out which specialty within physical therapy is right for them?
Yeah, so that is something you don't have to decide right away. I mean, I could change today. My clinicals help me with that. So being on clinicals through PT school, I mean, hopefully doing job shadowing when we're allowed to again someday. Honestly, I mean, like I said, I was dead set on being a peds therapist until that very last year. And that's really the benefit of PT. The specialist certifications, there's different things like pelvic floor. A lot of people don't think about pelvic pain and continence and PT doing that. All of that, you can start as a real general therapist. So when I was looking at jobs and applying, so the cool part about PT is there's usually a high job demand, and a lot of times you're doing the interviewing. You're asking, what is your continuing education? What is my PTO? So it's unique in that way that usually they want us and they're in need. And so I think that helps because that's what some of the questions I asked, because I knew I didn't want to do peds. I was kind of into orthopedics then, but I didn't know. And so my boss was very open to letting me, shadow with therapists that have been out 30 years. And that was something I looked for when I was looking at jobs. Where am I going to have the most opportunity to find my niche? And just like, I mean, honestly, orthopedic surgeons start out pretty general and then they sometimes hone in on a joint. And so I picked this working here because there were 40 PTs and a lot of newer grads, but also a lot of people that had longevity in the company that I knew I could learn from. So I started in neuro and that was all I did. And now I'm very specialized in orthopedics and do dry needling and have kind of fallen into that niche and not necessarily intentionally. And so you're always able to switch. There's always continuing education available. We're required it to maintain our license. So yeah, you can take courses geared to find out, do I like that? What do I want to do?
Sure.
So yeah, most of facilities that have PTs are very open to, are very supportive of continuing education and really trying to hone in on a specialty. So
Good, good. What are the most important steps or things that a high school student can do? What would you recommend that they be doing to figure out if PT is right for them?
So normally in these situations, I do recommend the job shadowing, and part of the requirements for that are doing career events like this. Obviously, with COVID, we have some different requirements. So we started taking students to get college students again. So I'm hopeful that job shadows are hopefully around the corner. But yeah, that was probably the biggest thing. But volunteering, getting out where you can do things. So I thought I had an interest in peds, so that's what I did. I volunteered at Christine Ann Shelter, working with kids in the playground area there. That's a abuse shelter for those of you that don't know. I volunteered at the respite house in Oshkosh it's like a respite program for kids with disabilities. And we'd go once a week and work after school with those kids. I was involved in the Key Club and different things like that. But honestly, I would say some of the things schools are looking for are leadership and things like that. So I got involved with the United Way on some of their boards and things. So that kind of thing. A lot of kids that apply for college and for grad school have good grades. And so you really need to do other things to make you stand out. I mean, doing things like this and getting out in your community and looking where can I volunteer? You know, do I think I might like to work in a nursing home or a setting like that? You know, seeing if those places have volunteer opportunities. Unfortunately, you guys are a little more limited with some of that stuff right now. But like I said, there's still a lot of people looking for help. Sometimes you can get jobs in high school as a caregiver, or even just a support system for somebody who's struggling and not doesn't have their independence. A lot of times those people do have home care therapists coming in, and that might be an opportunity during today to get in with that kind of stuff because they're looking for help. A lot of those elderly people that are stuck at home are looking for people to get groceries or and they do hire. I think they do. I think maybe you have to be 18, but yeah, I think things like that, just any community involvement looks good.
Sure, absolutely. So grades are one important component to setting yourself up to be a good candidate for a physical therapy program. But as you mentioned, Andrea, there are the other components that are definitely sought after as well. Those showing an interest in connecting and volunteering and gaining those relevant experiences. So if there was anything that if we could travel back in time, if there was anything that you could change related to your career or the path that you chose, what would you change?
I tell people every day that I love my job and the path that I've taken. I can't say that I have any regrets. I did worry about the decision to not go to Marquette and just get the master's then, but I'm very proud to say I'm the third graduating class in Wisconsin with a doctorate for PTs, and I don't regret that. I loved my time at Madison and really did get to explore the psychology major and end of things. And you know, I mean, did I spend a lot of time volunteering with kids and not go into peds? Sure, but I had fun every minute of it. So I really don't have any regrets. I love my job, and we'll see. I might regret this move to OSMS, but we'll see. I mean, it'll be an interesting dynamic working inside a physician building that isn't owned by the hospital and trying to, you know, juggle, but we'll see. But yeah, really, I can't say that I do. I wish I could think of something, but I love my job and I'm so happy I went this route. So, like I said, in PT, there's just, I mean, I went from being like the neurotherapist to C to the orthopedic therapist to C, and I really combine a lot of those. My neurologic patients have orthopedic problems, and my orthopedic patients have neurologic problems. So I can't say I do.
Fantastic. Can you tell us a little bit about how do you decide what a therapy plan is for a patient? Are there standard procedures that you have to follow, or how do you go about that process?
That's, you know, the initial evaluation usually will tell me a good piece. So as soon as I know that patient's name, we have access to all the electronic medical records at most of the referral places we get referrals from. So the doctor gives us the referral. I first look up their medical history and what comorbidities they might have. Do they have diabetes? You know, do they have a heart condition? Do they have a hypermobility condition, a genetic hypermobility or something like that? And then I'll look into those things before I even meet the patient. And so I generally kind of start to have a plan already in my head. What do I want to look at? So, like I said, in the evaluation, we get a lot of pieces of you know, are they weak here? Are they tight here? Where they feel pain isn't always where the problem is. And so I'm gonna look at their gait and their walking, and then I have a list of different treatment options and that's something newer and being more involved in chronic pain that I've done for patients. You know, I want you to write on this list, check the things that you've had before and what was helpful, and then tell me what wasn't helpful in the past for you before. Have you done chiropractor? Have you done other treatments? And then I ask them, are there things on that list that might interest you? So sometimes that's dry needling, sometimes that's aquatics or the pool therapy. So really that piece of just handing the patients that piece of paper, I tell them like, you know, we're on a team right now. Yes, I'm helping steer this, but I want to know what you want to do. So I do ask them often to what they think is why they think they have pain. And yeah, it depends on the imaging they've had done too and what that tells us to determine plan. But it's really individual. And like I said, the use of humor is huge. Some patients don't respond to that, and you can get a vibe on that right away. usually, and some patients take a little longer to warm up. So, and a lot of that is why I'm so thankful for the psychology background, because you can have the same diagnosis on different patients and it looks very different.
Absolutely. So let's bring our conversation full circle. Can you give us an example of how you use humor or techniques to connect with your patients that you're treating to help them overcome that feeling that they don't want to be there?
Sure. Yeah. So that, like I said, that initial waiting room question, I usually will say that because people will be like, oh, and I'm okay or good. And I'm like, really? And I'm like, why are you here then? And I'll joke about it. So I'll sometimes start off with that. Also, when I'm doing joint mobilization things, so there's one hip mobilization where I literally just pull their leg. So I'll joke that I'm just pulling their leg. And a lot of times, because of doing dry needling, it is painful. So I mean, I'll talk to them during, and a lot of them say the distraction, or even just me talking about, some things from my personal life, like not getting too personal, but maybe what I did over the weekend, or honestly making that kind of communication with patients is huge. And my patients get as involved sometimes in knowing what I have going on, if I'm buying a house or what I'm doing. And sometimes they're like, oh, I can't be done yet. I have to find out what happened. Or, whatever. It's great. I mean, I think those pieces and being able to joke with them, and it's like the awkward situations when one of the kids brought that up. Sometimes when I see males for groin pain, especially if they're around my age group, that's awkward. And it can obviously be a really touchy area. And so I joke sometimes about the paper shorts we have, and if they prefer to pull up or down, or if they want to see a male therapist. Because it is an awkward time for me, so I do use humor a lot when something is more awkward. But yeah, I think if you can get patients to laugh, and some of the movements I have people do, because I also have a certification what's called applied functional science. So they're kind of funny movements that I might have them do, shifting their hips and things like that. And so we have fun and might turn on music, or and it's okay to look silly. So
I think that's an important thing to remember, that, that those are all soft skills that we talk about in a job that are so important, and they're really essential to being successful as a physical therapist, because you might understand the technicalities of how to help somebody with, their ailment or their situation or their injury. But it's really that soft side that really is going to help someone get to the next level of success.
mhm. Yeah,
So
actually, so one of our referring physicians, this is a good example because he writes my name on a lot of orders, and I have about a 4 to 6 week waiting list to get in to see me, actually, which is very abnormal in PT. But I told him, I said, oh, I really like this new PT that started yesterday that I met. I listed his whole skill set and everything. Then he's like, well, Andrea, that's all great. I'll give him a try, but not everybody gives patients the TLC that you do. And a lot of that honestly is just me being me. And we've had students make, I had people that make it through PT school that don't make it through their clinicals because of not having those skills. And so it's very important, the confidence too, and patients being able to relate to
mhm.
you. And so, yeah, I mean, I do talk a lot, but it is using those experiences that patients respond to that.
Sure, absolutely. Well, I want to thank you for the conversation, Andrea. I learned a lot today, and I'm sure our students did as well. I need to turn the format back over to Nikki to carry us through our conclusion. But thank you so much for sharing your journey and your expertise today.
You're welcome.
Yeah, awesome. Thank you, Jamie and Andrea, for helping out with today's sessions. And that concludes our programming for today. I just want to shout out a quick reminder. Next week's session is going to be around urgent care in the nursing field. So if you haven't had a chance, you can sign up for next week's session as well. And other than that, have a great rest of your day, and we'll see you soon.